Mr. Williams is a World War II veteran who recently moved from his home to a senior community. He is suffering from depression brought on by the death of his wife and the recent move. He is also battling colon cancer, which makes him anxious. Mr. Williams has lost his independence. Due to chronic pain, he cannot drive. He is embarrassed by bladder control issues and has isolated himself. Mr. Williams has a supportive family but doesn't want to be a burden to them. He feels he should handle his own problems but doesn't know how. After Mr. Williams tells the building manager, "I am almost ready to die, I don't know what to do," the manager calls Mr. Williams' daughter. His daughter immediately takes him to see his physician and requests help for her father. The physician orders treatment from the medical team's Journey Behavioral Home Health Program, which is designed to help patients like Mr. Williams. Mr. Williams is in denial. Judy, the behavioral health nurse assigned to his case, knows he will resist her help. She's experienced in handling behavioral health problems and convinces him to let her help address the physical complications he is having from the cancer. Once Judy gains Mr. Williams' trust, she conducts a cognitive assessment and administers the geriatric mood and suicide risk scales to evaluate his depression. Based on her assessment and in consultation with Mr. Williams and his family, Judy develops a plan of care tailored to his individual needs. Judy determines that antidepressant medications are appropriate for Mr. Williams and contacts his physician for a prescription. After several weeks, the medications begin working, and Mr. Williams feels that he can be honest with Judy and discuss his medical needs. Judy consults with Mr. Williams' physician and revises his treatment plan. After several weeks, his bladder control improves, and as a result, so does his self-esteem. The Journey program includes teaching about depression. Judy teaches Mr. Williams that his depression may result from a chemical imbalance of the brain, which can be corrected. She also teaches him coping skills and ways to improve his mood. Due to the depression, Mr. Williams had neglected his personal care. Eventually, after a series of visits from the behavioral health nurse, Mr. Williams' treatment progresses and he accepts help with grooming and personal care from Julia, a specially trained medical team home health aide. Depression, brought on by the loss of his wife, transition from home, and complications from cancer had led Mr. Williams to contemplate suicide. The Journey program enabled him to regain control of his life and gave him the confidence and self-esteem to reduce his social isolation. If your patient or loved one could benefit from the Journey Behavioral Home Health Program, please contact us to learn more.